All right, nursing students, welcome back to another episode of Talk Teach Nurse. Today we are going to learn how to draw medication from a medication vial. What you need in this video is going to be a blunt needle, a 3cc syringe. You will need alcohol wipes. You will need a 10 milliliters of flush. And then you will also need your gloves. So in this situation, you will go ahead and make sure you are performing your hand hygiene and placing your gloves on in this situation. You just want to make sure you add that extra level of protection for your patients to avoid any cross-contamination while giving the medication. Now, I want you to go ahead and pop this open, and you can peel it off, you can pop it open, either way is fine, as well as getting your syringe. But as you notice, I keep the needle down and the syringe part open, and I'm only exposing a certain point of it until I'm able to place it on and twist the cap to secure it to it. You're going to twist that blunt needle and the syringe at the same time to make sure it's secure. To determine what size needle that you're going to get after you pop open your medication, you'll see that it's going to say on the side of the vial whether it's 2 milliliters in this vial, whether it's 5 milliliters in this vial. It just really depends. So in our case, it's only 2. So with it only being 2, that's how we know we're capable of using the 3cc. Once we popped our cap off, now you're ready to go ahead and scrub the top of that medication. Keeps you in the same ideology as scrub the hub. You're going to scrub for 30 seconds just purely to make sure that it is cleaned off and we've killed the germs that's on top of that medication. Once we're done with that, we're going to let it sit. Go ahead and make sure that we go ahead and let it dry. In this situation, you can also use this to insert it into IV, or you can use the same method if you're going to give a shot, for example, of some type of medicine. Now, once we're there, we're going to go ahead and draw back our syringe to 2 mLs while it's empty. Go ahead and pop it, and we're going to place it into the top of the vial at an angle, push the air in, flip it over, and allow it to draw back. It will draw back a lot faster in this situation. However, I've used this vial before, so it has multiple punctures, so it's a little bit slow. As you can see, my dose there is now at 2 milliliters based off of that. Go ahead and recap it. However, there's different methods of recapping. You should not do that one. You are able to kind of dip and recap, kind of float it into there. Once you float it in there and you kind of do that dip swish method, it allows you to avoid any type of needle sticks and any type of cross contamination to protect yourself as well. So now we're going to go ahead and take that other alcohol wipe and scrub the hub. So remember, we're going to scrub 30 seconds, 15 to 30 seconds, making sure that that's clean, because remember, the hub touches somebody's finger. A kid can touch it with their finger. Adults can touch it with their finger. It could touch somebody's skin and have all of those cross-contamination. So now that we allow that hub to dry, we're going to go ahead and place it on there. Remember, we're going to push and turn in order to make sure that that hub is actually locked and connected onto there. If not, half your medication is going to be on the ground, so or going to be on top of the patient. So we're going to go ahead and push it through. As you can see it going through the IV listed there. Go ahead and push through, twist it off. Now we're done with that. We're going to grab our flush. In this situation, you can already open your flush, or you can go ahead and pop it in while the medication's in the line. Now, flushes can be tricky. You see, I'm trying to push and nothing's coming out. So a good method for flush is to kind of pull back first and then push up to make sure that you have released the pressure that be in flushes in order to make sure they're going to flow forward. So go ahead and flush through your 10 mLs, flush through to your patient, make sure they're getting everything that they need, and make sure the line is clear with normal saline, but also make sure the patient is getting all of the medication that they are supposed to get. So go ahead and take that off. Now that we're done, go ahead and lock off your IV, and your patient is ready to rock. As always, thanks for watching and listening to Talk Teach Nurse. Like, subscribe, and comment below.